No doubt many people spent a lot of time over the beautiful weekend out in their yards and gardens and may be feeling some aches and pains today. One area that often takes a beating as we age is our shoulders. So today we have Dr. Peter Ugolini here, an orthopedic surgeon with Spectrum Health Medical Group. Okay, so a lot of people haven't been outside all winter and are kind of getting out, moving, crouching, getting in positions that maybe their body does not agree with at this point.
Yeah, springtime we see a lot of injuries to the shoulder, people coming in with sore shoulders. They're doing a lot of activities that they just haven't done for quite a while when we're all hibernating for the winter. So
let's talk about the mechanics of the shoulder, because it is an area where we can feel a lot of pain, whether we're doing yard work or we're doing exercising. What is it about the shoulder and how it's put together that may lead to pain for some people?
Well, the shoulder is a very interesting joint. It has the most range of motion and planes of motion of any joint in the human body. So it allows us to get our arms behind our back and over our shoulders and do all these movements. But basically how that happens is it's a relatively large ball on a smaller socket. And there's really no or very little bony stability to this joint. So a lot of it comes from the soft tissues. And so the mechanics of the shoulder are very important, and those soft tissues are very important, and they can have problems.
Yeah, okay, but you see a lot of them. What are some causes, or what are the things that sometimes people are doing that leads to pain in the shoulders?
Well, a lot of times in my practice, the key to the shoulder seems to be the rotator cuff.
Okay.
The rotator cuff is a group of 4 muscles. They attach to the scapula, and then they attached around the ball of the shoulder. And they help the shoulder move and they give it strength, but a primary function is to hold the ball steady on the socket so there's a pivot point for movement. And so when the rotator cuff starts to have problems, the mechanics of the shoulder can really get out of whack, and that can really cause a lot of problems around the shoulder with other structures.
What are some different types of treatment if somebody has shoulder pain? I mean, is it working it in a certain way? Is it therapy, surgery? What are the options?
Most shoulder problems can be treated non-operatively initially. So a lot of times when patients present to me, we'll try some physical therapy, again, to try and restore those mechanics. On some occasions, we can do some treatments for the inflammation that can happen, medications, even some types of injections can help. When people continue to struggle after doing some of these things, that's when we start to think about surgery, unless there's been some type of trauma or something like that.
Yeah, that's great. And I know at Spectrum Health you really have a team approach, so there are different experts in the different areas that can really lead to the desired outcome and feeling better. There's a seminar that's actually coming up that people, if they have more questions or they want to talk with some people like yourself, that they can attend and really learn a little bit more and ask specific things that might be more specific to their health or their problems.
Yeah, that'll be happening in a couple of weeks on May 19th. We're going to be doing that over at Calvin. I'll be giving a talk and have some time for questions also, so hopefully we can give some good information on shoulder problems and answer some questions for people.
We had some stats up on the screen not too long ago. This really affects a lot of people. I mean, there are a lot of people who suffer, and is there a time when you know you need to see somebody, and let's say, oh, I've had this pain for a long time and it's not going away, or not really sure whether it's time to do something and take an extra step?
Yeah, well, we're happy to see people anytime if they're concerned about their joints. A lot of times people will present to their medical doctors first. Maybe they've tried some therapies or some other treatments and they're just not getting better. But a lot of times I see people who just come in, they've had pain for 3-4 weeks and it's just not going away or getting worse.
Yeah.
And we can start from there as well.
Well, great. Great. Well, it's good to know that help is out there. I like the props you brought in too. Kind of tells the story of what's happening in our bodies. We appreciate it.
Thank you very much for having me.
And we'll be right back with more 8 West.